All right. Well, good morning, everyone. Thank you for being here. I'm happy to see large attendance. That's great. Let me just pull up my slides. And there. Okay. All right, so just get right into it. We have at this time 12 active cases in Nia Bay. We've had 42 cases total. That is certainly, I guess I just don't want to skip over the fact that that means that 30 people have recovered. So I do want to celebrate that and express gratitude that we have had that experience so far, but certainly very, very concerned about the amount of new cases that we've had, and certainly exponentially increased in the month of August. And then yesterday we had 4 new cases in one day, which is a record and certainly a lot for us to be able to handle as a health center. So I am very concerned but don't want to skip over the gratitude that I have for those 30 who have recovered. Nia Bay is in phase 1 of the Makah safety protocols, which means staying home except for essential and safe activities. All public and private gatherings are prohibited, and non-essential businesses may open with approved workplace safety plans, and those employees are allowed to go to work. For more information on that, stick.org has the Makah COVID-19 public health protocols and information about the phases. A couple of weeks ago, I started doing these little diagrams of how things were spreading in Nia Bay. And so I've updated it and taken off cases that have recovered. But what I want to point out, the 2 left ones, those are connected to an original case that traveled back, it was diagnosed back in the end of July. And that spread pretty rapidly through kind of some workplace settings and into households. And we're now still dealing with 6 cases related to that. However, most of the cases tied to that have recovered. The other 3, you can see in the bottom right and then top right and bottom left, those are all separate, not necessarily outbreaks, but cases that we are watching and that did not contract the virus through that other exposure. And I did not put together a predictive diagram for the next slide. I know I did that a couple of weeks ago, and it was good to follow and helpful, but at this point I haven't done that yet for right now. And I do want to go back to this and just make a mention. Certainly there's no confidential information shared here, and it's not our intent to do that. But if you have guesses about who these people are, please don't assume that your guess is correct. And we are certainly dealing with a lot of rumors that spread. And I know my staff here is working very hard to protect confidentiality. And so I just want to make a nod to that. Please don't assume that you know who these people are. That would be very helpful and just protect people's privacy in that instance. So certainly Column County is not looking very good as well. Their percent positive is 11.9%. Still seeing obviously that is a majority of unvaccinated patients who are coming down with those cases. They have 7 current hospitalizations, unfortunately had 1 new recent fatality. And then the rate of new cases per 100,000 in the last 14 days has been 532. And I'll show you more what that looks like here on this slide. So this is just showing a rate of new cases per 100,000. And as you can see, far exceeds where it has ever been, almost twice that rate of new cases. Again, mostly unvaccinated individuals, and just this line down here where it shows 25, like that's the goal, to be under 25. And we're definitely far away from that at this point. Okay. Sorry for the pause. It looks like there's a couple of individuals in the waiting room that I'm trying to let in. All right. Next slide. Okay, I apologize. It seems the internet is unstable and is my screen still sharing? Can anyone still hear me?
Yes, we still got you, Dr.
You still got me. Okay, I'm having technical issues. For sure. I don't know if it's my screen or what. Stop share. Okay, yeah, I don't know why I'm having, thank you, Erica. I'm having a couple of pop-ups saying people are in the waiting room. All right, is my slide up now?
You're showing.
Okay, great.
You're showing.
Okay, thank you. Go to the next slide. Okay, so Washington State, in position as Clallam County, things are going up, although Washington State has as a whole seen it before, but it is certainly increasing and is predicted to continue to exceed. I brought up some data just from a month ago, so you could see very clearly this trend. So if you look over on the top graph, this is the average on July 26. We had 56,635 new cases. That was rapidly accelerating at 144% increase. The deaths and hospitalizations were also rapidly accelerating, as you can see, 72%. Deaths were slowly accelerating. And now the second chart on the bottom, you can see there's 3 times as many new cases a day, but that is slowing down because that rate has already increased so much. But the rate of hospitalizations is also lower, and it's still like 3 times as much. And now the deaths are increasing. So that's because there's this lag. There's about a 2-week lag between cases, new cases, and then hospitalizations, and then about a 1 to 2 week lag, unfortunately, before we see people start dying. So this is certainly concerning and matches that pattern. And as you might have noticed on the previous one, we had over 1,000 deaths per day as of yesterday, and that's again reaching these highs that were really seen at the beginning of the pandemic, and again in our wave that we had at the end of the fall, early winter last year. So variants, this chart gets updated once a week, but as we've said before, the testing is delayed significantly. So we're only just now starting to see this increase in Clallam County. It said 15 for several weeks, even though we knew for a fact that there was more. And I would anticipate that there's actually several more Delta cases than even the 54. So it's at least 3 weeks, if not more, like a month or 2 behind in those testing. This graph shows the percentage of the cases that are sent off for sequencing, how much of those are Delta. And you can see by the orange that nearly all of them are Delta. It's significantly more transmissible. There's a new study that was early released yesterday, studying the infections and hospitalization rates. This study took place in Los Angeles and was looking at vaccination status. What they found was that the new case rates was 4.9 times, so nearly 5 times higher in unvaccinated individuals, and 29.2 times higher in unvaccinated individuals for hospitalization. Here you can see on the graph, so the black dotted line is unvaccinated individuals. So again, the majority of the new cases are unvaccinated individuals, and they are what is driving this spread. And then the solid blue line is fully vaccinated, and the dotted blue line is partially vaccinated. So this is rate of new cases, and this is hospitalizations. So as you can see, that 29.2 times more likely to be hospitalized if unvaccinated. And then I wanted to put together some slides. We are certainly getting a lot of questions about case and contact tracing and isolation and quarantine. And certainly if anyone on this call has questions, I'd be happy to answer them live. We have changed our close contact definition for us here in Neah Bay just because of what we're seeing. Certainly we're seeing transmission beyond 10 feet. We are seeing transmission where interactions are less than 15 minutes. So we've lowered it down to 10 minutes. And in any time one person doesn't have protection via a mask or the face shield with the mask. So that's what we're using and putting individuals into quarantine when that happens. We have had some people report that they didn't want people to find out about any exposure because they were afraid of being separated, especially from kids. We do not do that. We definitely don't do that. We always offer, if possible, if we need to get someone into a cabin based on the situation and the context, we have a lot of detailed conversations with them. But we try to make things as comfortable as possible because we want people to stay in that situation, whether it's alone in isolation out in the cabin. Some families are able to separate upstairs and downstairs where they have like a mother-in-law type setup or a basement or a cabin on their property. So we do have these in pretty intensive conversations and really try to figure out the best case scenario for each family and where kids are involved. It really does have to be on a case-by-case basis. Unfortunately, it can't be as black and white as we would like it to be. But we are certainly doing everything we can to make things as comfortable as possible. And then we do provide support and regular check-ins. And the EOC has also stepped in and supported us significantly by offering to facilitate shopping lists. We have been doing that pretty regularly as well, getting groceries, doing laundry for individuals. And in our regular check-ins, we ask the individuals if they need anything. And so that is happening. But again, I want to answer any questions here too, if people have them. And then this is just a plea from me to please get vaccinated. Please don't travel, especially on an airplane, unless absolutely necessary. And to please wear 3-ply masks over the mouth and the nose. This is the rubbers really hitting the road in terms of kind of our fears about this virus. The Delta especially is significantly more transmissible, and we are seeing that, and certainly seeing the hospitals get overwhelmed, and our staff are overwhelmed as well. So that's just, I know we've said it many times for over a year, but please just follow those COVID basics and stay far away, have only safe contacts, and right now certainly just no social contacts outside of household groups. And I know that there are a lot of people who are doing that, and to those people I just express a lot of gratitude and thankfulness. And we see it comes out when we do our case and contact tracing. And that's when we have minimal spread. So it does pay off to do those things. I know they're hard, but they help out a lot. So that is it, unless anyone has any questions for me.
All right, Dr. Coe, thank you for the update. I don't see any questions in the chat at this point in time, so we'll go ahead and move on to the tribes update.
Everybody, I just wanted to mention that the small business grant applications are still being reviewed by council, and they're going to be determining their guidelines for giving the amount of grants to the individual businesses. And also the employee testing, we're trying to get that wrapped up today. Hopefully we're going to get the Thursday, Friday staff, hopefully get them in there today to test. That's about it.
All right, well, thank you, Patty, appreciate it. The Makah EOC report out is just reminders, we're still in phase 1 at this time. I wanted to thank the community for abiding by the essential travel protocols. This meeting will be recorded and posted on the STIC website this afternoon. We didn't have the traffic rates tabulated as of yet, but they will be posted on the website as well, along with this briefing. I want to remind everybody to wear your mask, vaccinated or not. It is mandated in public spaces and all tribal buildings. Be safe when traveling for essential needs, and please take the proper safety precautions and measures if you do travel. The last reminder is please check the stick.org website. All this information is posted on there, plus additional information. Do not see anything in the chat, so I want to apologize for this is outside of our normal meeting time. So we do meet every Tuesday, 11:30. So we'll go ahead and conclude this meeting. David, we phase 2 as of yet. We're still in the response for this outbreak, but that will be discussed at a later time in the regular EOC to see if it's proper to make that recommendation. But at this time, I do not have a date for you as of now. So thank you. Appreciate all up every Tuesday. We welcome everybody and anybody who wants to participate and be in attendance for these meetings. So thank you guys. Stay safe. I want to thank the Makah EOC, STIC staff and EOC, and also Makah Tribal Council for all the work. Keep it up, Makah. We still got a little ways to go, but we're doing good. Please take all the safety precautions you can. So thank you guys and have a good day.